A recent report by the World Health Organization highlights critical shortages of blood in Uganda, raising concerns about the availability of life-saving blood transfusion for patients in need. To address this challenge, a delegation led by the president of the Association for the Advancement of Blood and Biotherapies, Professor Tobian, is in Uganda to share edge-cutting technology on how to make blood available and safe in Africa.
We can learn from each other, and certainly Uganda can learn from the challenges that other countries that ABB works with have experienced and how to find, for example, the space that the new technology, the new equipment requires. This is the same everywhere in the US, in the Middle East, and in Africa.
Making sure that the blood is free from HIV, hepatitis B, hepatitis C. Similar to us in the United States, there are always areas of opportunity to improve blood transfusion safety. Continuing to evaluate, are there specific antibodies to different blood groups, and how can we make the safest blood for sickle cell patients with sickle cell disease and other diseases is very important, and we can continue to work and collaborate together to improve that blood transfusions.
This is in preparation for the forthcoming 11th Congress of the African Society for Blood Transfusion happening from 4th to 7th March for the first time in Uganda.
Scientists from all over the world are coming to Uganda next week. Researchers, healthcare workers, advocates, anybody in this space of blood globally are coming to Uganda. So the Congress is about ways we can make blood safe, ways we can make blood sustainable in Africa.
Dr. Dabanje Agre blamed this to the public criticism that the Uganda Blood Transfusion Services is hesitant to distribute blood to government health centers, making those in need to pay for it.
Blood is an essential medicine. It is kept in a refrigerator under refrigeration condition for a particular period of time. For example, the platelets that I told you about that maybe people who are bleeding may require, we keep them for only 5 days, beyond which the platelets have begun to stick to each other and may not provide value to the patient that received that product. At that time, we shall say that's the end.
Uganda is still facing significant challenges in meeting the demands of its blood supply, where only 8 out of 10 Ugandans are willing to donate blood. This trend could be corrected if all Ugandans stood up for this cause. Mary Namkose, UBC News.